Hey hun, I hear you're here to get a little bit of lip filler today, is that right? Go ahead and have a seat to make yourself comfortable. I have to get you numbed up. I have your chart here. We can go over what you'd like to do, but first I do have to clean you off and put this numbing cream on, so have my gloves on. They're not going to be on the entire procedure, I promise. However, I want to get you nice and sanitized. I have my sanitizing pads right here. Okay. So, I'm just going to, with your permission, of course, I don't want to just dive right in, start poking and prodding at your face. Put a alcohol wipe all around the mouth right here. Is that okay? It will remove any residual makeup you may have on, any skincare products. We want the area completely clean. Don't worry, I'm not coming in with the needle just yet. We will take our time when that time comes, but numbing cream, it does take a little bit of time to absorb, babe, so I do have to kind of come in right away. Is that okay? Okay. There's nothing to be worried about. We will go through this step by step together, okay? Just want to get you nice and prepped up. You look so unsure. Listen, at any time if you feel uncomfortable, you can back out. I'm not going to charge you. You would look beautiful when you came in, and you'll look beautiful when you leave, regardless of the filler or regardless of what you choose to do, okay? It's completely fine. Okay, I'm gonna go in and just start wiping. Is that alright? I know so many of my patients come in with makeup, beautiful makeup, or skincare, and I go and just completely destroy what they worked on, and I do feel bad, but it's part of the process. And the process, especially afterwards, is absolutely beautiful. So, again, if you do choose at any time to back out, you get a little bit too nervous, you're going to look the same beautiful person as you walked in when you walk out of here, okay? It's not going to offend me. Alright, so let's go ahead and get this numbing cream on. This is 10% pure lidocaine. It's going to go right all over your mouth. I usually say a dab will do ya, just a little bit, but not in this case. We need to completely saturate your mouth. Now, quickly before I do, I want to ask, did you want any filler anywhere else in the lower half of your face? That includes the jaw area, that includes your nasolabial folds, these parts right here, or any cheek filler. The reason I ask again is because it does take a little bit of time before the numbing cream takes effect, so I want to make absolutely certain you're aware before I put that on. Okay, I will make sure to add that, and let's go ahead. Okay. Good. It's still not going to be enough, so I know, and it's probably going to get in your mouth too, so if you feel a little bit of numbing in the gums, I promise you this isn't the product you're thinking, but it's completely normal, okay? Promise. Alright, you good? Fantastic. While that sits, I have another doctor who's going door to door, just kind of talking a little bit about what they do. This takes 20 minutes to take effect, so we've got a lot of time. I'm gonna head out and let them come in, and whenever they're finished, we'll get started, okay, babe? Family, before we begin, I want to tell you a pretty sad story, one that you can probably relate to. As many of you know, and if you don't, I was recently diagnosed with psoriatic arthritis, and that's great, finally getting a diagnosis, but psoriatic arthritis comes with a broad range of symptoms, and I am the worst when it comes to anything that isn't direct. So headaches are a symptom of my condition, but that wasn't enough for me at 3 a.m. a few weeks back. Instead, I went doom scrolling, which turns into a minor symptom like a headache into a deadly symptom by the end of the night. And that's exactly what happened. I went to bed riddled with anxiety, and by morning I was comparing my anxiety with my psoriatic arthritis. You're probably wondering why I'm even telling you all this, and that's because I want you to learn from me. Instead of doom scrolling, I could have, and hear me out, you can too, instantly found and booked a doctor before I started typing as headache, a symptom of impending doom, etc., etc. But how can you casually find a real doctor so late in the night? Well, family, that is where ZocDoc comes in, the sponsor for tonight's video. ZocDoc is a free website where you can easily search and compare high-quality, in-network doctors so you can find the right doctor for you. ZocDoc appointments happen fast, too, typically within 24 to 72 hours of booking, and you can even score same-day appointments as well. And my favorite, you don't even have to talk to anybody, just book with a few clicks. Whether you're looking for somebody in-network, nearby, or with specific appointment times, ZocDoc quickly helps you find the right doctor to meet your needs. And plus, with tons of verified patient reviews and detailed doctor profiles, you'll get a real sense of the provider and their practice before you ever step foot inside an office. The best part, you can see the doctor's actual appointment openings, giving you the ability to choose a time that works best for you, and just click instantly to book a visit. And ZocDoc isn't just for one type of care. They have over 100,000 providers across nearly every specialty, from mental health to dental health, eye care to skincare, and so much more. It's the one-stop shop for all your healthcare needs, plus it's completely free. So learn from me, family, and stop the late-night doom scrolling. No need to put off those doctor appointments. Just go to ZocDoc.com/Karuna, which is also linked in the description, to find and instantly book a top-rated doctor today. Thank you so much, ZocDoc, for sponsoring tonight's video, and let's just get right into it, family. Okay, how was that? I completely understand. Let's go ahead, before we wipe the residual numbing cream off, I'm going to go ahead and make a few marks and measurements on your face. And that's where your chart came in earlier. I was looking it over. It looks like lots of other treatments. It looks like you were here twice, 3 times. Just judging by your past, you know this procedure, or that's okay. I'm just asking, and the reason I'm asking is because I wanted to know what you had done, and that's why we're gonna measure right now, okay? So, putting your chart there, we're gonna go back, and I'm going to show you on here just the mouth area and what you'd like. So I want you to memorize the parts of the body I'm going to be going over with you when we're measuring, and that is the Cupid's bow, which a lot of other people call it the angel's peak. Cupid's bow is right here. We can give you a more prominent bow, make your upper lip bigger. For some reason right now in the industry, everybody is making the top lip bigger. They did it to me when I had mine done, and a lot of other people talk about where. So people will put it right here in the Cupid's bow. Don't worry, I'm not going to touch your face at the moment. People put a lot of filler on the outside of the lips right here. It's all about what you want, doll. So let me get the face mask, which is right here, and I'm going to show you where. So here is the mold. What I'm going to be doing is I'm going to be taking already pre-packaged filler, depending on what brand you want. Juvederm, Juvederm XC, Vobellum, anything Restylane. A lot of it is different. So for example, Juvederm XC has lidocaine in it. So whenever I do inject, it's going to make more numbing, but I will admit it does cause a little bit extra swelling in the end. It's a lot more plump, where Vobellum is just a soft, natural. Whenever you touch the lips, it won't be as hard. So you can choose that. Restylane is for all over the face. They make Restylane soft, which you can put in your forehead. It all depends what you want. So, injecting right here on the Cupid's bow or angel's beak, down here on the bottom of the lip, right up here in the nasolabial folds. So, it's all a matter what you want. I was thinking to do a little bit of your Cupid's bow, make it a little more prominent. I was going to inject in the corners of your mouth. It helps prevent. It's preventative, so it'll make it plumper and prevent wrinkles. I can inject here in the lower part and just make everything a bit more standoutish. I don't suggest changing the lip structure, more making it and changing it in the way that you would like. So that's on you. Do you have any idea what you would like me to do with that information before I start marking? We can use that product, and yeah, I totally agree. I am so glad you agree with me. So let's go ahead and get started before I wipe that off. I know you're probably uncomfortable at this point. I use an eyebrow pencil to mark. It keeps its dot, and once I sanitize afterwards, it will stay for a little bit. So I'm just going to come in and I have a little stick here. I just want to measure, and what I'm going to do, I'll throw this one out. Like that. So I'm measuring your peak like a triangle. Measuring your outer corners with the corners of your eyes. Okay? That gives me an easy, symmetrical way of measuring, so I can properly fill in the proper measurements, okay? Don't worry, every one of my patients ask, is the numbing cream going to wear off? Is the numbing cream going to wear off? I promise you it hasn't even set yet completely. You are fine, my dear. There is nothing to worry about. The numbing cream is not going to wear off. So I'm measuring now, kind of, throw that one away, right up against. Don't worry, everything I do is completely sanitary, I promise. Okay, so what I'm going to do now is I'm going to have you put this and hold it just like that, okay? So open up a little bit. I know, changing them. I go through these like crazy. And just kind of hold it in your mouth, just like that. I'm not going to touch you without gloves. Just like that. I'm just measuring. Okay. Perfect. I think I did this exactly how I wanted. Now, when I do start injecting, I want to let you know, no exercise for the next 24 hours, no hot baths, nothing that's going to get the blood pumping, okay? And the reason for that is, let me get my gloves. this is going to cause a little bit of blood. And once the body gets traumatized, be it a cat scratch all over my hands or a deep cut, the body immediately sees an open wound as trauma and sends blood cells to cause an inflammatory response, basically. Your lips will look exactly the way they look immediately after I inject them. But as time goes on, they're going to get bigger and bigger and bigger. Some bruising is normal. Some pain is normal once the numbing wears off. Nothing you can't handle. I want ibuprofen only. No Tylenol for the next 24 to 48 hours, okay? And we do this on purpose. I do not want any excess bleeding. No makeup for the next 24 to 72 hours. No skincare. I essentially want you useless, okay? Alright. I can see you getting more nervous. Completely normal. Like I said, repetitive patients even get nervous beforehand. I will admit, okay, I'm going to go ahead and wipe this off, okay? I will admit the top lip is more painful than the bottom lip. It's more of a pushing pressure sensation. Some people feel the pinch. Other people feel the filler go in. I promise you, I have a very gentle hand. So nothing you have to worry about. Okay. Alright, sweet pea, are you ready? I understand. You seem a little tense, and that is why I'm going to give you a stress ball. Just give it a good squeeze. Are you angry at a man today? Did a man do something to you today? Well, in that case, you don't have to have one stress ball. You can have what that man lost. So go ahead and give that a squeeze, just in case you want to take out your... Yep. It's okay. Okay. I'll put this with you. And if you're ready, I'm ready. So, I will show you real quick what I'm going to do. Let's go ahead and open this. The filler is already in here. And I believe with the product that you're choosing, we can start out with about half an ml, which is 0.5 ml, I believe. Needle. Take it right off. But before we do, what I'm going to do is I'm going to take this and ever so gently, very small amounts. There's not a lot of filler in these. A dab will really do you with this. Just poke, push, poke, push, poke, push. And since we're not changing the shape of the lip and we're just kind of making your lips more noticeable, I'm only going to be working on the outside, okay? Only work on the outside. Okay? You're going to be fine. Are you ready? Take a few deep breaths. I completely understand, sweetheart. Again, I'm just going to gently poke and push. I'm also going to get another cotton pad. Again, everything whenever you manipulate it bleeds, if that makes sense. That didn't make any sense. Anything that you kind of pierce or puncture is going to bleed, so I'm not anticipating a lot. Just a little dab, like I said, like a kitty cat scratch. Kitty cat scratch. Alright, sweetheart. Let's go ahead and get ready. You squeeze those balls if you need to. You teach a man to do his job. Okay. Here we go. Be it if you're a man or not. Other men? Okay, I'm coming in now. Do you want me to tell you, or do you want me to just do it? Alright, so usually I lay people back, but for this, since we're just working on the outside, I need you to just relax, shoulders back, mouth ajar, like that. Very good. Relax. So we're going in, a little bit of poke. Yep, and push. Good. You did so good. How did that feel? About maybe 10 more. But you did really well. Okay, ready? Poke and push. Good. No blood so far. Everything is good. Okay, and we're on the upper lip, so if it's not hurting that bad, you're doing really well. But we are moving down to the bottom now. I do everything equal. Upper, lower, upper, lower, upper, lower. Okay. A little bit of poke and push. Okay. Another poke and push. Good. Okay, so back up to the top. We're going to be working on the outer section now, closer to the corner of the lips. Ready? Little bit of poke and push. Little bit of poke and push. Good. Okay, a little bit. Okay, ready? Poke and push. See, just very little bits of dabs of blood. Nothing that's super intolerable. You can do this. Are you feeling okay? You need anything? You're not feeling lightheaded, dizzy? It's completely alright. You need to tell me just in case, alright? We are about 55% done. Ready? A little bit of poke and push. Okay, so I'm going to be working upward now. So we're going to be going kind of rather than okay. All right. You're doing amazing with everything you're doing right now, okay? Okay, so ready? Coming in a little bit of poke and push. A little bit of poke side and the corners now. Little bit of poke, push. Good. Okay, other corner. Then I'm going to take a look. Okay, little bit coming in. Poke. And push. Okay, so I'm going to just take a quick look. Go ahead and get one of these. Just make absolutely sure everything is even. The longer I take to work, the more swollen that you will become. Okay. 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 One or two more pokes for me, okay? Okay. Coming in, just holding that there. A little bit of poke. Push. You okay? Close to where we went in the first time, I know. Okay. Okay. And one more poke for me, okay? Just gonna tilt that a little bit. Coming in and poke. Oop. And push. Good. Fantastic. So, you are done. I'm going to get a new cotton pad. And instead of using a alcohol wipe, we're just going to use some disinfectant. Okay, I'm just going to go ahead and wipe off any residual blood. Get you settled. Good. Okay, and now I want you to take a look behind me in that mirror. What do you think? I know they are beautiful. They were beautiful when you walked in, and they are beautiful now. So I just took these out of the refrigerator. Quickly do a little bit of lymphatic massage. I'm going to take these globes. Don't worry. A lot of estheticians like to pinch the lips and push, and it's very painful. I suggest if you just massage a little bit, it helps mold the lip, and we're not trying to do anything ridiculous today. No nasolabial fold injections, nothing like that, so we're just smoothing over the lips. Smoothing, smoothing, smoothing. It's gonna feel cold. Smoothing. Okay. Okay, good. Smoothing, 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 smoothing. Good. That is wonderful, doll. Okay, so how was it? Because that is it. You are done. Everything like that. Do you happen to have Ally rewards on your phone? Anything like that? It can help you get a couple dollars off filler. So remember that one. Tip from me. But I want, again, only ibuprofen if needed. Over the counter, definitely. No exercise, no hot baths, no hot tubs, no swimming, no jumping, no diving. Just for the next 24 to 48 hours. But no baths. about 72 hours. How's that? But how was it? How do you feel? They look beautiful. They're starting to swell, completely normal. Turn into a duck after the next 1 to 2 days, normal. They will not perfectly settle for 2 weeks, so you will not see permanent results for 2 weeks. And filler usually lasts about 6 to 8 months. Some can last well over a year. Every body's different. I personally go back every 4 to 6 months because my body likes to burn that filler very quickly. So with that said, I hope that you had a wonderful experience. Have a wonderful response. And I hope to see you again, okay? Schedule with me again, please. Alright, you have a good night. Be safe going home, and I'll see you next time. Bye.